Okay, hello everyone. Welcome and thank you for joining this very important discussion this evening. I'm Lindsay Palega. I am the co-chair of the St. Pete League of Women Voters Repro Rights Action Committee, alongside my co-chair Sarah Terry. Those of you who are members of our St. Pete League, thank you for being here. We wanted to note that we will be moving back into monthly repro meetings starting this month, maybe July. This might serve as our June meeting. Sarah, you want to give them an update on that real quick?
Yep. Hi, everyone. For our St. Pete League of Women Voters Reproductive team members, just want to make sure everyone's tracking. I'm going to circulate upcoming Zoom meetings. We're kind of waffling on the time just to make sure we're not overlapping or conflicting with any of the other programs going on with the League of Women Voters. We do have a lot going on this month, both for Yes on 4 folks that can participate in those items, as well as through the league. I do want to highlight league specific. You do need to be a league member to join this one. We have the all-member meeting for all Tampa Bay leagues on Thursday, June 13th. So be sure to check out my email for that sign-up link. And I know that Lindsay's going to kind of run through a couple of the other advertisements for the League of Women Voters and whatnot. But just want to remind everyone to sign up for those items, and we'll continue to have bi-weekly distributions for events and how to get involved for league members throughout the month and going into July. Back to you, Lindsay.
Thanks. So this is our second repro panel. We'll be doing these monthly, and we hope to see you at next month as well if you're interested in this one. The content's going to be a little bit different every month, but it'll always be relevant to reproductive health and reproductive rights. So I know many of you with us this evening are already league members, but we opened this event up to the public because we believe this information is so important to share with our voters. For those not familiar, the League of Women Voters is a nonpartisan grassroots organization that works to protect and expand voting rights and ensure everyone's represented in our democracy. So the League's nonpartisan. Why are we talking about abortion and Amendment 4? Because this is a nonpartisan issue. Without the ability to make reproductive decisions for your own body, all people cannot participate equally in democracy. Our Reproductive Rights Action Team stands for equal and safe access to the full range of reproductive health care, from abortion to birth control to evidence-based sex education. Unfortunately, as it stands, we have a 6-week abortion ban in effect in Florida. Our panelists tonight are here to tell us about the real impacts of abortion bans and government interference with reproductive health. To end the near total abortion ban we're currently living under, the Florida League is working with the Yes on 4 coalition to pass a constitutional amendment that'll limit government interference with abortion. Amendment 4 will appear on the November ballot, and it reads, no law shall prohibit, penalize, delay, or restrict abortion before viability or when necessary to protect the patient's health, as determined by the patient's healthcare provider. Our success in November depends on each of us getting involved in the Yes on 4 campaigns. There are so many ways to volunteer at the moment. I'll tell you just a few of those ways briefly. And the registration link for all of these opportunities can be found on our link tree, which we'll put in the chat now. Thank you, Amy. First off, this month, Yes on 4 will be coordinating outreach teams at the many Pride celebrations happening all around Florida, including the largest St. Pete Pride on June 22nd. And you can volunteer at these events by signing up on our link tree. Second, there's Yes on 4 Super Saturdays happening around the state every month. I'm sorry, that is June 22nd. I just skipped right ahead in my agenda here. The Pride events will be happening all month. June 22nd is Super Saturday. That is a really exciting event where people get together and learn how to talk about the amendment and share their own stories. This month, there will also be partners hosting a Canvas launch. Volunteers will learn how to talk about Amendment 4 and connect with voters. And then Yes on 4 is also urging voters to use a relational organizing app called Reach to connect with voters in your own personal network of friends and family. You'll use the app to track who's been reached and how they plan to vote on 4. It's a really, really cool resource. If you haven't played around with it yet, you can download the Reach app and you can reach out to our team and we can send you the invite link so you can start messing around, add family, add friends, whatever. We also have weekly Reach trainings on Tuesdays at 5:15 p.m. That's in the link tree. We have the live campaign phone banks on Thursdays at 6 p.m. There's no experience necessary. Yes on 4 will provide training and support while you're making these calls. That's something you can do from home, or if you're out of state and just want to help in Florida, that's a really good activity. And remember, all of that is in the link tree in the chat. You can also join us for our next event, reproductive health, or next event in the next panel. It'll be next month on July 10th at 6 p.m. That one is titled Reproductive Health Resilience, Stories from a Pre-Row and Post-Row World. We'll have individuals with pre-row healthcare stories to share, people who lost family members or their fertility pre-row days. And then we'll also have an expert on Florida fertility law there to speak about the impact of restricting reproductive health care, what that has on family planning. So if you have a pre-row story to share and you haven't already reached out to Sarah, myself, please reach out prior to the event and we can include you in that one. These stories are really impactful. I know they're very difficult to tell, but it's one of those things that we can take with us when we're talking to friends and family who are open and receptive and might be kind of on the fence about this. These are the things that we'll take with us, and hopefully tonight's event does that for you too. Finally, please join your local league if you're not already a member. Local leagues do so much important work. We do work on the environment, education, voter engagement and education, and on reproductive health. There's something here for everyone, no matter the political party you've traditionally identified with. We're the group that puts out those really cool Vote 411 guides that you probably find online whenever you're trying to learn about candidacy voting season. And then we're also completely volunteer-based, and we understand that your time, your energy, your finances are endless. So come to the events that you can, take on as much as or as little as you can, donate as much or as little as you can. And then the membership is available on a pay what you can basis. And that also means we'll accept donations larger than the suggested membership amounts. So if you would like to join the local or state league, a local or state league outside of St. Pete area, it's a pretty easy Google search, but that's also, if you just go to if you're in Florida, the Florida League of Women Voters site, that'll bring you there, or whatever state you're in. They're all over the state, all over the country. So with that, let me please introduce our guest panelists for this evening, Dr. Lara Hart and Michelle Grimsley Shindano. Dr. Hart is an OBGYN practicing in Georgia. She's going to discuss the impact of Georgia's abortion ban, including stories of her own patients who nearly lost their own lives, as well as pregnancy and fertility due to confusion surrounding these extreme bans. And Michelle is the Director of Public Policy with the Florida Alliance of Planned Parenthood Affiliates. It's a mouthful there. She'll discuss Florida's version of the near total abortion ban and its impacts, particularly on Planned Parenthood health centers. She'll also offer an update on the Yes on 4 campaign. So with that, Dr. Hart, would you please kick us off?
Okay, great. I'm really excited to be here talking to you guys. So thank you so much for inviting me to speak to you guys. I'm gonna share a quick little PowerPoint that I have just to kind of run through some info, and then I'm going to share my stories with you. So let me get this pulled up here. So, you know, I just kind of want to review like what it's been like to practice medicine in a state with an abortion ban, because we had our abortion ban go into place back in 2022 as soon as Dobbs was overturned. I wanted to let everyone know I am an assistant professor with the AU-UGA Medical Partnership, soon to be the University of Georgia School of Medicine in Athens, Georgia. I'm not speaking as a representative of the school, though, and I'd like to make that clear. I am speaking as a private practitioner of obstetrics and gynecology in the state of Georgia since 2012. So this is kind of the timeline of Georgia abortion access and what we were faced with. In 2007, they passed a mandatory ultrasound law that required you to have an ultrasound before having an abortion, and that certainly is restrictive in its own right. In 2019, HB 481, which outlawed abortion after the detection of fetal cardiac electrical activity, or a heartbeat, as they like to say, was passed. Due to the fact that we still had Roe v. Wade protection, it basically was kind of immediately kicked up and to an appellate court and then to the Supreme Court, and kind of put on hold at that point. The federal court injunction holding off on HB 481 was then ended on the 23rd of November in 2022. Although as soon as Dobbs had been passed down there earlier in that summer, everyone kind of didn't really know what to do, because we went back and forth up until November of like, the ban was on, the ban was off, the ban was on, the ban was off. And then on the 24th of October of last year, the Supreme Court upheld the ban permanently. So since the overturn of Roe, what we have seen across the country, and definitely here in Georgia, is statistically significant increases in maternal morbidity and mortality, and an infant mortality increase in our state. The only exclusions in our bill were for renal agenesis, which is an absence of kidney growth, acrania or anencephaly, which is the absence of fetal skull development. I apologize, my dog is trying to join the talk here. And for the life of the mother. And I put that in quotes because it is extremely vague, and I will outline kind of how that has affected us. In June of 2022, basically right as Dobbs went down, the Atlanta City Council actually put through a resolution that decriminalized abortion in Fulton County. And they basically said that they would not criminalize abortion in the city, and they wouldn't uphold it. So what basically we have been faced with is patients opting for contraception instead of conception. The day Dobbs happened, my office phones were blowing up with women requesting IUDs, requesting contraception, saying, I want to have a baby, but I can't do it right now with what's going on because it's not safe. We've had to send patients very far for care. Right now, Colorado and Delaware are the closest places that our patients can go. Florida used to be our safe haven that we would send people to, and that got taken away. It really has delayed the standard of care. Things we would normally do have been getting delayed for fear of criminal penalty. And then increased morbidity. Some of this is very anecdotal. It's hard to judge morbidity. Things like, psychological and, physical harm that doesn't result in death, but does result in, issues later on. So I have two cases that I'm going to share with you guys. The first one occurred in October of 2022. It was a patient who was it was her 6th pregnancy. She had no living children. And then the second case I'm going to talk about happened in February of this year. And it was a patient pregnant with her 2nd child that we diagnosed the fetus as having acrania at approximately 14 weeks. So the first case started, like I said, it was October of 2022. I was coming on call on a Saturday morning, and I was getting checkout from one of my partners who was telling me about this patient who'd been admitted at approximately 19 weeks, pregnant with a twin pregnancy. As I said, she had no living children. She had never progressed past 24 weeks. And she had ruptured her membranes. And initially, a standard of care at a rupture of membranes at 19 weeks would be to deliver and offer an induction or termination of the pregnancy, due to the fact that we know that there will not be significant fetal lung maturity, and we won't be able to keep that patient pregnant long enough to reach a viable stage of pregnancy. But due to the uncertainty of the laws, like I said, it was one of these like on again, off again things. Nobody spoke to her about that. No one talked to her about that. That was not offered to this patient. And so she, after having been admitted to the hospital for approximately 5 days, so about 2 days before I took over her care, she went into respiratory arrest. She started to develop a fever. She subsequently had decreasing O2 saturations, and subsequently that day required intubation and admission to the ICU. Now, traditionally, a fever with ruptured membranes, that is chorioamnionitis. That is an infection. You have to be delivered at that point. And the person on call didn't do what we would normally do. They didn't deliver this patient. They ordered a chest x-ray, which radiology read as maybe pneumonia, maybe fluid overload, but the standard of care wasn't followed. And the next day, everyone just continued to kind of say, oh, maybe it's pneumonia. So I came on about 48 hours after she had been admitted to the ICU and was told that she's now on pressors to keep her blood pressure up. She was on maximum ventilatory settings, including a nitrogen oxygen mix called nitrox, which is kind of a last ditch effort before we have to start performing ECMO to keep you oxygenated. So this woman was very, very sick. And my question to my partner is, why is she still pregnant? And the response was, well, I mean, the law, the law says we can't do anything. And I said, I don't think that's what the law says there. But that uncertainty of this law, and if we do something, will we be prosecuted? And my partner said, well, I don't want to risk my license. And I think it struck me in that moment that I guess I didn't mind risking my license because I didn't want to see this woman die. So I jumped in the car, drove as fast as I could to the hospital. As I was driving, the ICU physician actually called me and said, I don't know what else to do. We cannot keep her alive. We need to do something. And I said, she needs to be delivered. I'm coming. And when I got there, I entered the room. I met her husband, who I had never met the patient or her husband before. I had to sit him down and have a conversation with him that we had reached the point that I could save his wife or I could save none of them, but I could not keep her pregnant anymore. And we were not going to be able to save these two fetuses. He was very upset, as one would be, but we gave him some time to kind of process. And then he came back and he said, please save my wife. We walked her down to the ORs with her, 3, multiple IV poles full of various medications she was on. The vent, the RT had to come with a respiratory therapist, had to come with us. We got into the OR. I proceeded to do a hysterotomy, which is essentially a C-section on a pre-viable pregnancy. And I delivered these two twins. As I entered into her uterus, though, it was plainly obvious that she had an infection. She was febrile. She was very hot. When I opened the uterus, it smelled terribly. It was an obvious infection. I quickly delivered the infants, passed them off, and the nurses were able to rush them over where we'd set Dad up in a room very close to the ORs so that he could at least be with them as they passed. I then proceeded to try to close her uterus, get her back put together, at which time she began to have uterine atony. Her uterus did not clamp down as it should have. And this was probably due to how infected it was. And she began to hemorrhage. And I tried a few maneuvers that I would normally perform in that situation. And it wasn't working. And I ultimately had to make the decision to remove her uterus. And within 6 hours of leaving the OR, she was better. She was not febrile. She was getting weaned off the vent. She didn't need pressors anymore. It was very clear at that point that the choreo was the reason she was sick. And if she had just been delivered sooner, she would not have ended up in that situation. And I had to go tell her husband that, I saved her. She's good, but she doesn't have a uterus. She will never be able to attempt pregnancy again. And it really just made me angry that I had been put in this position, that any woman was put in this position, that we physicians were not practicing medicine to a standard of care the way that we know it needs to be because of a law that some legislators passed that we had no say in, that they didn't talk to us about, they didn't listen to us about. So that was the first case. In February of this year, I had a patient, my midwife came to me and said, I have a patient who, the baby has acrania. Can you come talk to her about, her options? And so I, went and talked to her and her husband. This was a very desired pregnancy. They had a little boy at home. This was a little girl. They were very excited because this was going to be the completion of their family. And when we did that ultrasound around 14 weeks, it didn't look right. And we sent her to maternal fetal medicine to get a second opinion, and then they confirmed acrania. So I went and spoke with them, and I gave them their options. Basically, this is not a fetus that's going to survive. You may stay pregnant. You may stay pregnant all the way to term, but you're not going to deliver a baby you're going to take home with you. And she understood. She actually had Googled pictures of an acrania fetus. And what she said to me was, I don't want to do this anymore. I don't want her to hurt. I don't want to do this. And I said, okay. I said, we have two options. I can bring you to the hospital and I can induce your labor and I can get your cervix to dilate and you can deliver vaginally, or I can take you to the OR and I can perform a DNE, which dilation and evacuation. And she didn't even have to think too long. And she said, I want you to do the surgery. She said, I can't deliver her. I can't see her that way. I don't want to. And I said, that's fine. You don't have to. I just like to make sure you have your options. So I got her set up for the procedure. Our hospital had already, when Dobbs happened, the lawyers got involved. We had a whole checklist of, you can't schedule it unless it meets all these criteria. And we, of course, met all the criteria, got it scheduled. I show up that Monday for surgery. I walk into the ORs, and at the OR desk, they said, Dr. Hart, have they talked to you yet? And I said, about what? And they said, anesthesia doesn't want to do your case. And I said, what do you mean anesthesia doesn't want to do my case? What's wrong? And as it turns out, anesthesia didn't want to do my case because the anesthesiologist on that day that was overseeing everything just didn't feel comfortable and was very unsure, with the law. And I said, there's no question. This is literally clearly one of the three things they actually carved out for. There is no question. Well, I need to educate my staff. I said, I will do a quick education of your staff if needed. Who needs education? I will be happy to. One of the anesthetists standing behind him said, well, I don't want to risk my medical license. And I just turned to her and I said, do you really think I would purposefully do something that would risk anyone's medical license here? And I turned to, and I will say, he and I were getting into some strong words in the hallway, and the chair of the Department of Surgery stepped in and got involved, and I was told I needed to calm down, which, a woman just loves being told she needs to calm down. I turned to him though, and I said, if you're going to cancel this case, you have to go tell the patient you're canceling the case. And he, honest to God, told me, oh, that's not fair. I'm not going to do that. And all I could think was, what's not fair? Because really what's not fair is that this patient is sitting here in tears, waiting to have this procedure done. And I'm going to have to go tell her that we're not doing it today. And we had brought her in the day before, and we had placed something called Dilapan, which are some hygroscopic little rods we can put in the cervix, and then they swell up over those 24 hours you have them in, and it just helps dilate the cervix and make the procedure a little bit safer, a little more comfortable. So she had these in, and I went back down and I told her we cancel the case. I did tell her because anesthesia didn't feel comfortable doing the case. And I said, you know, I need to take your dilapan out. You're going to be dilated, which walking around significantly dilated is dangerous. Again, she can get choreo, she can get infection. It can happen really quickly. And I had that experience previously, and I did not want that experience again. And so I offered her to go upstairs and that we would induce her, even though she didn't really want that. And she turned to me and she said, but if he won't do my anesthesia down here, will he do my anesthesia up there? And I said, well, I don't know. And we checked really quick. And he said he would. He was willing to do anesthesia for her, to force her to deliver this fetus vaginally, but he was not comfortable giving her anesthesia so that she could just go to sleep, wake up from a nightmare, and not have to remember any of it. And when I told her that he would give her anesthesia, she looked at me and said, did I do something wrong? And I said, no. You didn't do anything wrong. I said, we're doing everything wrong. We have failed you. We have failed you in medicine at this point, and I am so sorry. She couldn't do it. She didn't want to do it. I didn't want her to do it. I knew she didn't want to do that. I promised her that I was going to work to get her rescheduled as soon as possible. I gave her very strict precautions because if she even had, I told her, if you even have a little uptick in your temperature, I want you to call, I want you to come back to the ER and I'll just tell them we have to do it. It's an emergency. So I got her rescheduled 2 days later. The OR manager was amazing. She worked diligently to get her rescheduled. The anesthesiologist on that day, when I came in that Wednesday, everything went the way it should have. He was kind, he was gentle. He was actually upset because he said if they had just called me on Monday, I would have come and done the procedure. And everyone in the OR was gracious and kind, and the patient got to go to sleep, and we played her favorite music as she went to sleep, and we tried to make it as good as we could for her. And I was very grateful. I was able to actually able to get her fetal footprints. I was actually able to get little footprints because the tissue was intact enough. I was able to do that for her. And, you know, it just was this example of we can't have politics in our reproductive choices. It is nonpartisan. It's not a red issue or a blue issue. It's not a GOP versus Dem independent. No, it's just a human issue. It's a human issue. That these restrictions, there is so much. I always tell my medical students that in obstetrics and gynecology, we have this much black and we have this much white and we have like all this gray area. And really, all of this is all this gray area. And you can't list out all the carve outs that you would need to for when an abortion is needed and when it's not. Just when you think you've seen it all, something else comes up. And I hate that we have these restrictions. I hate that it's different depending on what state you live in. It makes it very difficult to practice medicine here in this state. I wanted to cry for y'all when they passed y'all's ban, but I'm so happy to hear that y'all were going to get this amendment put up for a vote so that y'all will actually get a say in how your state does things. Our legislature has gerrymandered the issue to where we have to have 2/3 of our House and 2/3 of our Senate agree before something can go up on the ballot. And that'll never happen in our state. So I really, I look forward to seeing how this vote goes, but I just want to share kind of my experience because I don't want this to happen to y'all. I don't want your physicians to have to be dealing with this. I don't want y'all as patients or family members of patients having to deal with this. So thank you again for letting me talk to y'all.
Thank you, Dr. Hart. I truly don't know how you continue to do it. And thank you for continuing to provide the best and most compassionate care that you can under the circumstances. I think your story is, there's not one, like you said, there's not one good reason for abortion care. There's not 1,000, there's not 1,000,000 good reasons that can be listed out. And while your stories are some of the stories that encompass cases where there were very wanted pregnancies, there's also circumstances where we could list out 1,000,000 reasons in circumstances where pregnancy is not wanted, and trying to put all of those emotions and experiences and backgrounds and just the whole human experience into a piece of paper. It's impossible.
Yeah.
And as an attorney who's studied these laws, not because I'm paid to, just because I'm interested, far too frequently and too in depth, they're already pages and pages long. I mean, the proposed legislation this year in the Florida legislature, some of them were over 70, 80 pages long, and that's on abortion alone. So, and that's, like you said, not encompassing any.
Yeah.
So,
I mean, I think really like the thing I've seen as a OBGYN for, I'm going into my 13th year of private practice, plus my 4 years of residency before that, plus medical school exposure. And what I have found is that you can't look at a woman and say, oh, she's never had an abortion. That'd be a big old surprise, because a lot of women have, and a lot of women have, like you said, for very different reasons. And it's none of my business. And it's nothing I need to judge anyone on or anything else. If a woman chooses to have an abortion because that is what's right for her at that time, I support her in that. That is all anybody needs to know, is that that's the right decision for her. And it doesn't affect anybody else. It just doesn't. And I think that's why it blows my mind that these laws happen, because it doesn't affect anyone else. It truly is just a decision in a woman and her doctor and anybody else she chooses to talk to about it. But I think there's a lot of misinformation. I think there's a lot of disinformation about what abortion is. I think far more women have had what we in the medical profession consider to be an abortion without realizing it. And I think if we kind of normalize that language a little bit more, I was glad to see when Chrissy Teigen lost her baby. And at the time, she kind of just said, I had a miscarriage. Well, then when she really thought about it, she said, no, actually, I had an abortion. And she did. She was induced. She was induced and delivered a baby that was pre-viable and did not survive. That's an abortion. It's an abortion just like any other abortion. The vast majority of the abortions happen in the first trimester. The medication that we use to perform abortions in the first trimester is safer than Tylenol. Yet we sell Tylenol over the counter, but we're banning abortion. So, I mean, we could talk about this for hours, so I don't want to take up too much time, but it just, I think because there's nowhere else in medicine that anyone's stepping in and saying, oh, no, you can't do that. No one's stepping in and saying, oh, we can't sell Viagra across state lines, where Viagra is actually very dangerous, but we sell that through mail order online. You can call up Hims and go online and you can get your boner pills, no problem. But we're keeping women from accessing vital care. And it's just very frustrating. But again, thank you for your time.
Thank you. So Michelle, do you want to tell us a little bit about, you want to talk about Amendment 4, how things are happening in Florida? Oh, sorry about that. And if you could tell us how Planned Parenthood what Planned Parenthood's doing, what impact Planned Parenthood's seeing in funding, and what we're doing next, what we can all continue to do.
Sure. Thank you, Lindsay and Dr. Hart. no pun intended, my heart goes out to you. I am thankful for patients being able to have a healthcare provider like you that really cares about them and understands the importance of this. I think the biggest thing about one of what you said, limiting government interference with abortion is what we need. And that's exactly what our Amendment 4 is going to do. That's exactly why our Amendment 4 is so important. And all the volunteers and all the efforts being put forth to this amendment and this initiative are vital to this access to healthcare. I'm very happy to be able to say that on June 1st, which was the 1 month, it marked I hate to call it an anniversary because it's not a celebration, but it was the 1 month of our 6-week near total abortion ban going into effect. The Florida Alliance of Planned Parenthood Affiliates officially endorsed Amendment 4. And so all of our efforts, we've had some staff transition over from Planned Parenthood to the staff for the campaign. We're just putting every effort that we can possible into winning this fight come November. Since the 6-week ban took effect, we as an organization in Florida have had to turn away more than 300 patients. 30 days, that's basically 10 patients a day that we've had to turn away because of this ban going into effect. We have a patient navigation team, so those 300 patients were immediately connected with our patient navigation team so that they could help them access care in another state. Just to put this in a little bit of context for you, that number is only for Planned Parenthood. Our organization represents less than 1/3 of licensed abortion clinics in the state. So if that's our number, just imagine what the true number is statewide. To date, more than 120 patients have been navigated to states with access by our patient navigators. We have seen that most of the patients are going to North Carolina, which if any of those patients are from South Florida, that's still more than an 11-hour drive to access abortion care. As we know, the way that the 6 weeks is counted is not, it's really hard for someone who isn't tracking a pregnancy and tracking their cycle to know that they're pregnant at 6 weeks. So what we're finding is a lot of our patients now have absolutely no idea that they were pregnant, could have been pregnant, and are far past the 6-week mark. They either have irregular cycles, just weren't thinking about it, a number of things, but they have been far past the 6-week mark to be able to receive care. What we're seeing is a lot of our patients are super, super frustrated. They're very angry, rightfully so, and are saying, why can't I receive care? And I'm a Floridian. This is where I live. I pay taxes here. Why can't I receive healthcare in my own home state? And I work on the policy side of things, so I can talk about this stuff, but I can't even imagine what it's like to be a doctor or a nurse or any of our clinical staff standing there in front of a patient having to try to explain this to them, and because it just makes no sense for a lot of people, and it's just flat out wrong. We're seeing more patients who are very anxious about remembering the first date of their last menstrual period. A lot of that is because they don't track their cycles. But we are still providing abortion care for patients who are under and at 6 weeks. These patients, I wanted to ask Dr. Hart, if you in Georgia have a 24-hour waiting period. That's something that really affects us in Florida.
Yeah, so ours, the ultrasound law that was in place is still in place. So basically, patients have to get an appointment with one of the abortion providers that's still open, which a lot of them, did kind of shut down and move on. Or, they're getting an appointment with my office to come in. Then they have to get an ultrasound, and then they have to figure out where to go after that. And so there's a large delay, and again, like every hour counts at this point with these. And for a lot of these patients, they're getting that ultrasound and they're finding out that they're 6 weeks and 1 day, 6 weeks and 2 days, 7 weeks, 8 weeks. And that happens a lot. I see that a lot. And it's, yeah, it's happening quite a bit. And there's a delay then because of the ultrasound situation.
So the way that ours works in Florida is patients come in, they have that day one consultation, and they get the ultrasound to verify the gestational age, but there is, even once that's done, there's still the 24-hour mandatory waiting period. So imagine someone coming to us now 6 weeks and tomorrow's too late because they're 6 weeks in a day. So there's just a lot of frustration and anger for our patients. And this 24-hour waiting period was already bad, and now it's just highlighted how awful it really is, because it has absolutely no medical basis for implementing that 24-hour waiting period. Although the number of patients that we have has diminished drastically, we're still seeing a steady number of patients who don't know where they stand with their pregnancy. They don't know how far along they are. They may have gotten an at-home pregnancy test that's positive, and they're just trying to wrap their head around things and understand all of their healthcare options. So we have more staff helping out with ultrasounds and gestational dating. We go over all of the options, whether it's prenatal care, which we do offer up to 14 weeks of pregnancy, adoption, referrals, and abortion care services up to 6 weeks. And we also go through patient navigation if that patient is after 6 weeks and they want to receive abortion care. Our patient navigation team is absolutely extraordinary, and they really go through that process from point A to point Z with every single one of those patients. So we have really seen them working overtime to make sure that patients are receiving the care that they need. But it is always up to the patient what they want to do. So we give them all of their options, we listen, and then we move forward with the decision that the patient wants to go forward with. Another thing that we all know really hurts us in Florida are fake clinics and these crisis pregnancy centers. And it's my mom used to always say, you gotta laugh, because if you don't, you'll cry. My husband and I are late watchers of Grey's Anatomy, and so we just are finding out about Station 19, which is kind of like the follow-up for Grey's Anatomy. And Dr. Bailey started the reproductive healthcare clinic on Grey's, and there was an episode on Station 19 where they were talking about removing funding for the reproductive healthcare clinic. And so Dr. Bailey and another doctor did like an undercover sting operation to go into the crisis pregnancy center that was luring their patients in. And boy, did that really hit home. The doctor had on a white coat, was talking to the patient as though they were very careful to make sure that they don't identify themselves as a doctor. They don't give medical advice. And if you're the patient, you probably aren't thinking about all of these things, but I'm noticing all of it. And it's exactly what they're doing in the state of Florida, which is awful. Even more awful because our state gives them $29.5 million a year to operate. And I just can't understand for the life of me why they couldn't find something else to do with that $30 million. But these crisis pregnancy centers are pretending to offer legitimate medical services and counseling, and that is not what they are there to do. So it is very important that we are bringing awareness to those CPCs, making sure that people don't walk into them by mistake, making sure that people understand that they can still receive care. We had a patient come in that made it under the wire because a crisis pregnancy center kept changing and extending and prolonging their appointment date because they were just trying to get them past 6 weeks so that they could not receive care. That happened in real life at one of our health centers in Florida. So these people in these centers are absolutely dangerous. So we are making sure that we are letting patients know and putting out there abortionfinder.org, verify that the clinic that you are looking into is an actual licensed abortion clinic in the state of Florida, because these crisis pregnancy centers are really causing a lot of pain for our patients. I'll go into a couple of patient stories that we have heard since May 1st. The day the ban took effect, we had a patient who was exactly 6 weeks pregnant. The patient had previously scheduled an appointment for several days prior to the 6-week ban taking effect, but because of work, they couldn't get off and they had to keep pushing their appointment back a few times. What that patient didn't know is that the ban was coming. And so those few days made such a world of difference in that patient's life. She missed her window for receiving abortion care in Florida and had to travel to Virginia, more than 500 miles away, to be able to access abortion care. Another patient arrived at a health center after learning that she was pregnant. She had just had a recent hospital visit, and that's where she learned that she was pregnant. When she found out at the hospital visit, she was 7 weeks and 1 day pregnant, absolutely in shock, didn't have any idea that she was pregnant, and definitely didn't know it was 7 weeks. So of course she comes in, we tell her about the 6-week abortion ban and why she's now forbidden to receive care in the state of Florida. And after she processed that news and realized that her only option, she processed and then realized that her only option was to travel to another state that had access. So just those two things, those two stories tell you how devastating this ban has been for a lot of our patients. But at the end of the day, our health centers are still standing. Our employees are still fighting to give access to care to patients that can legally receive it. We have had an increase in providing other services, contraception, STI, cervical cancer screenings, annual Pap exams. We offer prenatal care up to 14 weeks. We are able to now increase our patient intake for gender affirming care. We are offering fertility testing and treatment as well, sexual dysfunction care, and we recently in our Miami Health Center launched vasectomy services. So there's still a lot of work that we're doing, and we are still navigating our patients to states that they can still receive care in, and we are hoping to expand on some of those services in other locations throughout the state. We know that our communities need us, and we're not going anywhere. We're still fighting because healthcare should be free. I'm sorry, abortion care should be free from government interference. Today, Floridians Protecting Freedom, which is the campaign for our Amendment for a Ballot initiative, won a court case. And I just get so excited when I can say that we won. So our legal team fought a case today. Some of you may remember the financial impact conference from, I think it happened during legislative session. And so what the impact statement that came from that conference would follow the ballot language on the amendment language on the ballot for November. And we found that that language of the impact statement was outdated. It was wrong. It was incorrect because it was based on numbers from the 15-week ban. Now we are living under a 6-week ban. Of course, the state agencies, different departments didn't want to do that. So we took it to court, and Judge Cooper found that the financial impact statement was inaccurate, ambiguous, misleading, unclear, and confusing. So just to be able to have that on record is absolutely amazing. I'm super excited for this financial impact estimating conference has to go back, redraft a statement with information and numbers from the impact on the 6-week ban. So I think this is just the first win of many and our final big win for Yes on 4. A lot of you are volunteering for Yes on 4. The biggest thing that I think we're doing now are Super Saturdays. Yes on 4 has staffed up, has gotten a really diverse group of folks from across the state. And the organizing side of the campaign is really beefed up now. And we've got some constituency-based organizers that are working with groups across the state to work on messaging for various communities. And that's something that we've been getting lots and lots of questions about. And so I'm just really excited to be able to see that take off.
Thanks, Michelle. We really appreciate these updates. It's important to hear about what clinics and are doing beyond abortion care. It's important. There's a lot of places out there, including doctors' offices, that don't have the big pink PP next to them, are doing all the time. And I imagine it's very difficult for doctors like Dr. Hart to do their jobs right now under the oath that you took. So with that, I know we're getting to 7 right now, and it's, I don't want to keep everyone here all night. I get it. Let's open it up for some Q&A. If you don't mind, I am going to kick off the Q&A, and I want to pick on an audience member who's with us tonight, Chris Lawler. Chris, are you with us and able to answer a question for me?
Yes, I am.
Thanks. Okay, so Chris, for those who don't know, is the board president of Tampa Bay Abortion Fund. I was hoping that spinning off of Michelle's information on Planned Parenthood, that you could tell us about local abortion funds like Tampa Bay Abortion Fund and how donations are being used now. How have donations trended since Dobbs and since the ban? What are you doing with those funds now? All of those relevant things. And then Michelle, if you didn't already answer it, I think you did, but if you could tell us the same for Planned Parenthood after Chris is done, I think that's an important first question.
Awesome. Thank you. And this has been awesome. Thank you for putting this on. We're the Tampa Bay Abortion Fund, and we work with our local clinics here in Tampa. There are abortion funds all over the state, but we specifically focus on the Tampa Bay area, and we do work with our local Planned Parenthood. And we love our patient navigators at Planned Parenthood. We work very closely with them. So shout out to them. They're amazing. But for donations, we saw a lot of what I've heard people call like rage donations or, frustration donations as these bans go into effect. We've seen a lot of these when the Dobbs decision came down, but when the 6-week ban went into effect, we did not see the same type of donations coming in. After Dobbs, we were able to fund over $50,000 a month for abortion procedure support and practical support, which means like childcare funding or rides and things like that. So we're really trying to keep that momentum up during this 6-week ban because of those barriers and the out-of-state travel that Michelle and Lara both outlined. We are seeing a lot of clients need to travel out of state. But in addition to that, we've also talked to clients about self-managed abortion and abortion pills. So this all of the donations that come into Tampa Bay Abortion Fund go towards helping clients access clinic appointments, practical support, those types of things. And we have seen a decrease in that. So we are trying to get out into the community and get get word out there and get some more people involved. Yeah.
Thank you. I appreciate that. For those who don't know, I do some judicial bypass work here in Florida, and that involves having to get court permission from a judge before a minor can obtain an abortion if they don't have parental permission for any number of reasons. And Tampa Bay Abortion Fund has been really critical in helping some of these people get access to care, and that includes so much more than what you think. It's not just the abortion procedure. It's an Uber to the courthouse if you need a judicial bypass. You have to take, that's a minor, they need to take time off school, they have to get there, they have to get home. That's not cheap if you're a minor and you're, it's who knows what reason you're there for. On top of, then there's the healthcare, there might be continued care afterwards. There's all of these different things that need funded. The 24-hour waiting period, I mean, that means everything's double. They're not just going once. And depending on the county you're in, you're filing one day, then you wait for a hearing, you're back to the courthouse for the hearing. You might be there 3 times in a week, plus the 2 doctor appointments. So all of these things that cost a lot. If that's a $20 Uber and you have to take it 5 times both ways, that's a lot of money for a minor. These are the sort of things that people don't think about. On top of what the cost of abortion or any other sort of reproductive healthcare can be. And I've also seen some really cool circumstances where it just ends up being sort of reproductive health education in that end as well. And that's important because they wouldn't have got there. They wouldn't have got that education without those funds. And that helps them continue to be healthy and safe and, keep themselves it's also important. I know I'm speaking to the choir here. So with that, does anyone else have questions for our panelist? I don't want to keep everyone here all evening, but I know these are real experts here with us tonight. So if you have a question, please go ahead and raise your hand, or just unmute. No questions? Okay, if you don't have any questions, I am going to put the registration link for our next event in the chat. This next month is pre and post row stories. These are also going to be really impactful stories from people who needed abortion care pre-row. I know one story in particular has to do with losing fertility because somebody was going off to war and they weren't prepared to have a child in that circumstance. So a little bit different circumstances than we're facing today, but history repeats apparently. I wish it would stop. And then we also have an IVF specialist, an IVF legal specialist who's going to speak to how these bans are impacting fertility in other ways. Things like keeping embryos at facilities in certain states where they've legislated those issues. And these are some of the more nuanced issues, but again, important to talk about if you're really on a line with someone who's like, I don't know exactly how I feel about this. They're not thinking of all these implications down the line. So if we can give them that information, I think it's really hard to argue with things like that. What link is broken there, Amanda? Is that the sign up or the TBFA updates? I think that's the TBFA. Okay, so the TBFA updates or TBAF. I'm so sorry. I do that every time. Chris, that link is broken. Okay.
Lindsay, along the lines real quickly, if anybody was paying attention this afternoon, the bill went up in the Senate that would have protected access to contraception, and it failed because the GOP voted against it. So again, they are politicizing things that shouldn't be political. So we just have to like keep an eye out because it's just going to get worse, I think, before it gets better at this point.
Yeah, and again, we're a nonpartisan league. This is a nonpartisan issue, but this is something that, you know, we've seen taken up by probably more extreme politicians. And I think it's even people on either side of or on any party line are feeling that this is wrong. And I hope that we can all come together on this again and kind of normalize as much as politics has ever been normalize them again. Voting's important. This is the reason we're doing it. This is the reason the league exists. And we're seeing a lot of women come back together on this issue. So let's not forget after this.
Lindsay, can I say one thing really, really quickly?
Of course you can. Yeah.
It's campaign season. I know this is a super involved group, and I just want to throw out there, as you're talking to candidates, make sure you are also talking to them about how they feel about the implementation of the of the amendment when it passes. Dig into what their thoughts really are past just abortion, because there are some things that we're going to need to do, and we're going to need some strong champions in those elected positions to be able to truly implement our amendment for when it passes and implement it in a timely fashion. And this is going to probably happen during legislative session. So we need to make sure that we get the right people elected, not just those that answer yes to a couple of our questions because it sounds good. So try to tailor your conversations on the campaign trail. Thanks.
Thank you. Appreciate that. That's good. Yeah, I think with that, everyone, we hope to see you next month. If you're not part of the leagues, join the leagues all over the place. Thank you so much, Dr. Hart and Michelle, for being here this evening and sharing your valuable time with us. I think I both laughed and cried tonight, and I had to turn my camera off for a second. So Dr. Hart, thank you specifically for those tears. But you know, they're tears that matter, and that's why we keep doing this. We'll keep doing it. Thank you all. We'll see you soon.
I'm gonna stop the recording now.